Hello, my name is Elizabeth and today I am going to be performing an abdominal assessment. Like all assessments, I am going to start with inspection of the abdomen. Are you okay if I start my assessment now?
Yes.
Okay. So to begin with the inspection of the abdomen, the first thing I'm going to look for or look at is just the skin, noting the color, noting the vascularity. With the color, I'm looking for any discoloration, so any bruising, possibly from trauma. I'm noticing if there's any bluish discoloration in the flanks, and that could be a sign of a retroperitoneal hemorrhage. And I'm looking to see if there's any reddish on the skin that could be a sign of like a cellulitis, a skin infection. The next thing I'm looking for is if there's any scars on the abdomen. This could be an indication for any surgeries that the patient has had. Sometimes they aren't a good historian on their surgeries, so you can tell if there's different scars if they've had surgeries. I'm also looking to see if there's any striae, or also known as stretch marks. This usually isn't a pathological sign. It could be due to weight gain or loss or pregnancy. However, there is some diseases that are associated with an abnormal amount of stretch marks across the abdomen. The next thing that I'm looking for is if there's any dilated veins on the surface of the skin that are visible, and this could be a cause of portal hypertension, often found in liver cirrhosis. And then I will also look at the umbilicus, just noting the color, the location, and the contour. If that is seeming to be like a bluish color, or has like a bluish discoloration on the umbilicus, it is known as Cullen's sign and is often related to acute pancreatitis. And then just noting if the umbilicus is symmetrical, if it's deviated one way, and then the contour of it. The next thing I am looking for is just the overall contour of the abdomen. I'm looking for any general distension of the abdomen, and it's important when I'm looking at it, I'm looking midline, so like from the xiphoid process, umbilicus, and down, and then also at the flank sides too. Noticing if there's any generalized distension, so if it's sticking out or if it's distended on just one side or the other. I'm also looking for this symmetry of the abdomen. And then when the patient is breathing, I'm looking at the overall abdominal movement with his breaths. I'm looking for that motion with respiration. Normally the abdomen wall moves. It decompresses with an inhale, and then the opposite with the exhale. If it does not move, it could be a sign of peritonitis, and it means the abdomen is very rigid and does not move with the breathing. I am also looking to see if there's movement with the peristaltic waves, which is the muscles of the abdomen contracting to move contents through the bowels. And then the last thing I'm going to do for inspection is have the patient lift his head up to assess for any umbilical hernias. So go ahead and just lift your head up, and you could see it bulging out if there was a hernia present there. Okay, you can relax. You don't have any. And that completes the inspection part of the assessment, and next we will be moving on to auscultation. So when auscultating the abdomen, I'm going to split it up into 4 quadrants and listen on each side. And the first thing I'm listening for is just bowel sounds, noting the intensity, the pitch, the frequency of them. This might be a little cold. So I'm going to start in the right upper. And then the left upper. Move down to the left lower. And then the right lower. And I'm listening for like the tinkering and the pinging of the bowel sounds. And I should be hearing about between 5 and 30 a minute in each quadrant. The next thing I'm going to auscultate for is any friction rubs. So for the friction rubs, I'm going to listen over the spleen and the liver for the splenic or the hepatic friction rubs. So I'm going to start on the right hand side using the bell of my stethoscope. I'm going to first listen to the liver. And then I'm going to go over to the left hand side, on the side a little bit more, and listen to the spleen for any splenic rubs. The friction rubs sound like a creaking or grating noise, similar to if you rub your thumb and fingers together. And then I'm going to listen to the aorta with both the diaphragm and the bell of my stethoscope. I'll start with the diaphragm. So the aorta, I'm just going to listen right above the umbilicus. And then it branches down to the right and the left. It splits into the iliac and the renal arteries. And then splits down into the femoral. And I'm listening for just vascular sounds, if there's any bruits, which are those turbulent sounds. And that is it for the auscultation. We will move on to the percussion. So for the percussion part of the assessment, I'm going to use my percussion technique where I tap my dominant hand onto my non-dominant hand finger when laying it on the abdomen. And I am just percussing all 4 quadrants of the abdomen for tone, and then I'm listening for that tympanic sound. So I'm just going to do a couple taps in each quadrant. You want to hear that drum-like tympanic sound. If you hear a dull sound, it could mean that there's fluid in the abdomen, and that would be an abnormal finding. Next, I'm going to percuss the liver for location and size. So I'm going to start midclavicular line right above the umbilicus, and I'm just going to percuss upward until it changes from that tympanic to dull. Okay, and then I'm just going to mark that area, and then I'm going to move up, and I'm going to percuss between the ribs, and then move down until I hear that dull sound again. So right about there, and then you can measure the liver that way. And a normal border should be between about 4 and 7 centimeters. I'm going to do percussion on the spleen. The spleen is under the ribs up on the on the left side, and so it is much harder to percuss. So what I'm going to do is go kind of around the 10th rib. So he's got 12 ribs, so I'm just going to count up here. 1, 2, okay. So around the 10th rib in that intercostal space, I am going to percuss there. And if it's dull, I'm going to have the patient take a big deep breath in and then percuss again a little bit bigger, really fill it, yep. And then if it changes to tympanic, that means that the spleen has shifted. And that means that there's no spleen enlargement. I won't be able to shift if it was enlarged. The next thing I'm going to do is check for CVA tenderness. So to do this, I'm going to have the patient sit up so I have access to their back. Okay, so CVA tenderness indicates that there's a possible kidney infection. So the way that we're going to test for this is to find the last rib posteriorly. So you can kind of just feel around for that. And then between the spine and this rib, because the rib kind of curves, so between that, is where the kidney is located. And I'm going to use, instead of doing the tap method like we were percussing on the front, I'm going to place my whole hand here and kind of use my fist and give it a thump over this spot. And you should do a couple times and do it on both sides. And then ask, is there any pain with that? And if there is, that could mean that there is a kidney infection. The last part of the assessment will be palpation. So we're going to start just by using the my fingertips and just do very light palpation. I'm going to note if there's any tenderness or guarding. Again, I'm doing it in all 4 quadrants. This is a great way for the patient just to kind of get familiar with you touching their abdomen, if your hands are cold, if they're ticklish, before we go into the deep palpation. Okay. So the deep palpation, I'm going to start on the right side, which the main structure over here is the liver that we'll be palpating, as well as the gallbladder, which is kind of positioned right behind the liver. So what I'm going to do is push down and then up under his rib and try to feel the lining of the liver border. So I'm going to kind of push down. It's going to be pretty deep. Are you okay? Sorry. Okay, this is going to be a little bit harder. Push down and then kind of pull up under the rib, trying to feel that liver border. I'm going to have him take a big deep breath in, and the liver should come down and kind of hit the tip of my finger. So exhale again, sorry, and then do it again. Big deep breath in. Kind of feel the liver move down and hit the tip of that finger. Then moving over to the left upper quadrant, we're going to attempt to feel the spleen, which is more on the flank side of the abdomen over here. And if you can feel the spleen, it actually means that it's enlarged, so it's an abnormal finding. Just kind of feeling around his rib, and I do not feel his spleen. And then the right lower quadrant is the appendix and the bowel. So if there's a lot of pain down by the appendix, that's concerning. And then the left lower side is just the colon, and this can be a little bit tender when you push on it, but it shouldn't be like painful. You're doing okay? And then I'm also just going to palpate the umbilicus to see if there's any defects or basses, or if you can feel that, like we talked about earlier, the umbilical hernia, that kind of bulge in it. And then I'm going to palpate the aorta, and this is just slightly above the umbilicus. If you have the patient bend their knees, it's usually easier to palpate. In a thin person, it'll be a lot easier to palpate as well. It should be pretty easy to feel. Okay, the next test I'm going to do is looking for ascites, or fluid on the abdomen. This test can be performed in a couple different ways. The first thing I'm going to do is kind of percuss the abdominal borders, just using that same percussion technique as we did earlier. And it would be tympanic. Because of the fluid, it should be tympanic. If there's fluid, it would be dull. And then I will have the patient, and the reason being it'd be on the sides is because the patient is laying like this, and so the fluid would move out to the sides, and so you get that dull sound over there, and then the tympanic in the middle. And then what you can do is have the patient move over to their side, and then in this position that fluid would all accumulate down on this side, so it'd be the same thing where it'd be tympanic percussion up here and then the dull down in the fluid. Okay, you can roll on back. And then the next thing I'm going to palpate is just for the urinary bladder. A full bladder presents as like a pelvic, like a mass, which is typically regular. It's like a smooth, firm, oval-shaped mass feeling, and it should be midline. And empty bladder, which I think yours is empty, cannot be palpated. The next thing I'm going to do is a test for appendicitis. There's different tests you can do. I'm going to do the rebound test. And what I'm going to do is over this right lower quadrant area, I'm going to push deeply into the stomach and then let go. And I'm going to ask you what hurt more, me pushing or me letting go?
Pushing.
Okay, if it hurts more when you let go, it's called rebound tenderness, and that can be a sign of appendicitis. Another test that can be done for appendicitis is iliopsoas sign. And what I'm going to do is with a bent knee like this, I'm going to push against the right thigh, like I'm going to push down and have the patient push up against my hand. So go ahead and just push up. And then does that cause any pain in your abdomen? If it did, that could be a sign of inflammation in the abdomen. Okay, the next test I'm going to do is a test for cholecystitis. It's called Murphy's sign. So in the right upper quadrant, I'm going to do that deep palpation over like where the gallbladder would be, so kind of behind that liver. And I'm going to have the patient take a deep breath in. And if there's pain when they're doing their inspiration for their breath, and they have to stop due to that pain, it means there could be some inflammation in the gallbladder. So I'm going to push down, take a big deep breath. And he was able to take a full deep breath without any pain. And that concludes the abdominal assessment, including our inspection, our percussion, palpation, and auscultation. Do you have any questions for me? Okay, thanks for watching.